Here's something that stopped me in my tracks. Nearly 1 in 3 kids in America today are battling some form of chronic illness. That's not just a statistic, it's a wake up call about the health of an entire generation.
Those numbers are absolutely staggering. How did we get to this point?
Well, when you look at the data, it's actually pretty shocking. Back in 2005, we were looking at about 16% of youth with chronic conditions. Now we're approaching 30%. That's nearly double in just 2 decades.
That kind of rapid increase must have multiple factors driving it.
You know what's fascinating? It's this perfect storm of environmental toxins, changes in lifestyle, and even better diagnostic capabilities. But here's what really caught my attention. Where a child lives can have as much impact as their genes.
Hmm. Can you give us an example of how that plays out?
So, there was this really interesting case of two siblings with asthma. Same genetic makeup, but one spent weekends with their grandmother in an area with less pollution. That child had significantly fewer asthma attacks, despite having identical genes. It really shows how environment shapes these conditions.
That's exactly the kind of real world example that helps us understand these complex issues.
And you know what's particularly concerning? The geographic and racial disparities we're seeing. Kids in the Southeast US, especially in rural areas, have much higher rates of certain conditions. And in urban low income areas, you've got this compound effect of environmental pollutants, poor housing, and limited access to fresh food.
So, we're really talking about a social justice issue as much as a health crisis.
Precisely. And it gets even more complex when you look at how schools are trying to handle this. Many don't even have a full time nurse on site, yet they're dealing with dozens of students who need daily medication management or special accommodations.
Well, that must create some incredibly challenging situations for both staff and students.
Absolutely. I heard about one middle school where they had over 30 students requiring daily medication management, but their nurse was only there 3 days a week. Like, imagine trying to coordinate that while also maintaining normal school operations.
That sounds like an impossible situation for everyone involved.
But here's where some innovation is happening. These comprehensive pediatric chronic care clinics are popping up, where kids can see multiple specialists in one visit. And technology is making a huge difference too, with telehealth appointments and monitoring apps helping families manage care more effectively.
Those kinds of solutions must be particularly crucial for families dealing with rare conditions.
You know, that's such an important point. A surprisingly large portion of these chronic cases are actually rare diseases, conditions affecting fewer than 200,000 people in the US. And these families often have to become experts themselves, coordinating between specialists who may never have treated their child's specific condition before.
The emotional toll on these families must be enormous.
It really is, but that's where we're seeing some encouraging developments in support systems. These aren't just support groups anymore. They're sophisticated networks sharing information about new treatments, coordinating with researchers, and even influencing policy decisions.
So, what do you see as the most crucial changes needed going forward?
Well, we need this multi pronged approach: better school funding for health services, more comprehensive insurance coverage, and stronger environmental protections. But most importantly, we need to recognize that this isn't just a health issue. It's a societal challenge that requires collective action.
That really brings it full circle, from individual cases to systemic solutions.
Exactly. And while these statistics might seem overwhelming, they're really a call to action. The better we understand the scope and complexity of this issue, the better equipped we are to make meaningful changes that will help these children and their families not just survive, but truly thrive.
This concludes today's episode, but if you'd like to learn more about pediatric chronic diseases, please visit theadvocatevoice.org/pediatric chronic disease. And if you find our podcast helpful and informative, don't forget to tap the like button, share for others to enjoy, and subscribe or follow
Depending on your listening platform.
for updates on future episodes.
Thanks for listening, and until next week, stay positive and informed.